I was diagnosed on December 31st, 2008, and I met Dr. Sharda because he was recommended to us from Dr. Dixon. I was in pretty bad shape. I'd lost a lot of weight. I was down to 133 pounds. Dr. Sharda just had such a positive attitude, and I had told him that I never quit, and he said, good, because neither do I. And the two of us together, and of course my tremendous wife's support, worked this thing out and stayed at it. And every time I came, I felt better. And the attitude of the people here, I think, had a lot to do with that. Well, I think Dr. Sharda's office here is friendly. It's super clean. The people that work here all are genuinely interested in what you're doing and how you're coming along. They try to adjust your appointments to your time schedule so that you aren't inconvenienced and have to be at two places at the same time. And they know you. They recognize you by name when you come in. When my mother, who passed away from cancer, was at another center, she was, lack of a better term, a number. She came in, you waited. Then they would get her to a room, and it just seemed to take forever to do whatever procedure it was that they were going to do. And it was like as soon as she was done, they didn't know her anymore. We tried to get her to come here to see Dr. Sharda, but my mother had this doctor for over 20 years, so she did what he said. So she wouldn't come here, and she's gone. Apparently, I was pretty well gone or bad off, and Dr. Sharda just gave you that feeling that you were going to beat this thing. I don't know how to explain it. It's just that it was like he knew it, I was believing it, my wife was believing it, and we did it. If I were to get cancer again, I would be pounding on his door. I would definitely come back. I think the other thing I like about Dr. Sharda too is, it's been 5 years since I had cancer, and he has never once told me, you're cancer-free. He tells me I detect no cancer, and I trust that man's word. If Dr. Sharda says he detects no cancer, there ain't no cancer there.